And finally tonight, we all know the hassles of seeing a doctor or waiting for hours in the emergency room. What if you could bypass all that? Well, one young physician had a bright idea that's making that possible, and in the process, he's helping patients and doctors too.
You write in and you just say, hey, I have a sore throat.
Jay Parkinson is a doctor. His patient, our healthcare system.
Everybody knows healthcare is broken and inefficient.
That's why he started Sherpa. The 2-year-old service provides access to doctors 24/7, online and on the phone. They can answer questions, give advice, diagnose problems, prescribe medications, and speed the referral process. And it's paid for by employers. More than 100 companies are paying about $30 a month per employee to offer Sherpa as a benefit.
Nobody's ever said this is a bad idea, ever.
Certainly not Martin Refsal.
I woke up one morning and I just felt deathly ill.
Refsal works at Canary, a New York tech startup. He has a primary care physician, but calls Sherpa instead.
In less than an hour, I had a prescription called in to the pharmacy just down the block, and I had a referral to a specialist who I went and saw later that afternoon.
Better yet, communications with Sherpa don't generate any insurance claims. Parkinson says the service is reducing claims by about 70%.
So the company all of a sudden looks really healthy. So their premiums increase much less.
It's not the first time Parkinson has mixed medicine with modern technology. In 2007, his first practice literally took to the streets in Brooklyn. He was carrying about $280,000 in student debt and couldn't afford to rent office space. So he began texting and emailing with patients. His story attracted national media.
Half my day was spent answering reporters' questions, book offers, movie offers. It was insane.
Instead of trying to become a star, he dedicated himself to improving the healthcare experience for patients and for doctors.
The doctor has this hierarchical position, and what this does is put the patient in charge in a big way.
Ida Santana is a staff doctor at Sherpa and earns more than she might as an average primary care physician.
It's really kind of moving medicine into an electronic age where most doctors don't email with their patients, and that's like, who doesn't email?
So far, companies are using Sherpa in New York, New Jersey, and California, with Illinois coming on board soon. White Ops is a New York cybersecurity firm. Its COO, Ash Kalb, stumbled across Sherpa and is now a big believer.
And we started talking about what the ideal healthcare program would look like. And we didn't think it existed, but I started Googling around and I came across Sherpa, and it was basically exactly what we had described to each other as what we'd like.
Kalb thinks having a doctor on call is making his company more efficient. His employees don't need to see a doctor in order to communicate with one. And that's what Jay Parkinson calls progress.
To me, the future of primary care looks a lot like what we're doing here.